Hi, I'm Dr. Laurie Negro, a cosmetic doctor and medical advisor to Mesoaesthetic UK. Pigmentation is a common problem in clinical practice, particularly amongst neophytes, that is to say, a new patient presenting to a clinic. It can happen in men and women and across all Fitzpatrick skin types. There are also often complicating comorbidities that make treatment options difficult. For example, active acne. I work in a multidisciplinary team. We use many medical devices and I use lasers frequently in my practice. However, in the last few years, I've become somewhat of a convert to Dermamelan when treating pigmentation. Lasers, as we know, can be tricky with a steep learning curve, and I found Dermamelan to be simple and predictably effective in all Fitzpatrick skin types. Dermamelan is a full face formulation that also provides pre- and post-care for patients. A pre-peel solution in the form of a peel booster can be applied to the patient's skin for up to 6 weeks prior to the treatment, or a 48-hour in-clinic pre-peel can be performed. This prep phase allows us to reinforce the treatment plan with the patients, as well as provide an opportunity to prescribe any additional supportive measures, for example, antivirals in patients suffering from herpes simplex virus. The core peel is normally applied first thing in the morning, the first appointment of the day, and remains on the patient's skin while they continue their normal day for between 8 and 12 hours. This is a painless process, and patients simply wash the peel off at home. What determines the length of the treatment are factors like the patient's skin type and age and the oiliness of the patient's skin. They will present again to the clinic at 48 hours for the initiation of their treatment maintenance cream. This allows us to have a hands-on approach with our patients at all times. I'll do a separate video at a later stage going into the individual ingredients of Dermamelan, but in summary, it's a multi-action formula comprising a tyrosinase inhibitory stack, inhibitors of eumelanin and melanogenesis, along with exfoliating agents, vitamins, and adaptogens. Dermamelan has high efficacy. You can see this in these images of a 42-year-old patient presenting with extensive melasma. We all know how hard melasma is to treat, and to achieve results like this in a single treatment can change your clinical practice profoundly. These results are after 90 days and speak for themselves. The results visible with the naked eye are dramatic, but it's useful to look at the Woods lamp images in this case. In fact, a 90-day in vivo trial showed an average reduction in melanin score of over 70% and a reduction in the full face MASI score of over 83%. There is excellent data on the product with both in vivo and in vitro trial information available to provide to your patients, so they can understand the implications of such a high efficacy treatment. Advantage number 1 of Dermamelan was efficacy. Now we can delve further into other advantages. Number 2, and as important as efficacy, is safety. We all understand the value of having treatments that are safe in clinical practice. What sets Dermamelan apart from device-based treatments is that it can be safely used in all Fitzpatrick skin types from 1 to 6, a truly colorblind treatment. There are virtually no contraindications and side effects rare and barely significant. Fractional laser systems can be very useful in clinical practice, but one has to be careful when introducing a high temperature into the skin. Energy-based devices have a high risk of post-inflammatory hyperpigmentation, which is an unfortunate side effect, and when it occurs, will result in patient dissatisfaction and complaints. In order to minimize such risks, it's prudent to use a system which is safe in all skin types and introduces no heat into the skin. Additionally, apart from a little redness and itching, this is a pain-free procedure. The absence of pain can be a very important motivator for patients, and it's a lot easier for us as doctors to recommend a treatment to patients that we know will be painless. The third and final point I'd like to make is that as a clinician, adding this to your practice will incur no additional capital outlay. Mesoaesthetic keeps high levels of stock and products can be ordered for individual patients only. This is a very important consideration for those of us who are growing our practices, as devices carry very high capital costs and can take a very long time to realize their return on investment. I hope this covers the main motivators for considering Dermamelan. To reiterate, they were: Dermamelan is a highly effective treatment. It is simple to use and safe and can be applied to all skin types. Doctors can add this treatment to their clinical practice without incurring any capital costs. So if you'd like any more information, please follow the links below or contact us via email. You can find us on social media on Instagram, Facebook and Twitter. Thanks for watching.